There have been several systematic reviews and meta-analyses done. One recent one, which was done in 2021, showed that yoga was helpful, had moderate reductions in depressive symptoms across a variety of psychiatric conditions. So schizophrenia, bipolar, anxiety, major depression. And this review actually showed that it was dose dependent. So the more, the better.
Like I said, the image that I have is 20 fit, mostly, well, not even fit, just really flexible women, and then there's me in the back just struggling and groaning and trying not to tear my hamstring in half as I touch my toes.
In terms of the types of yoga, there are hundreds of different types, like hatha, vinyasa, yin, and so for folks who are just exploring kind of community classes, I would say, try different classes, see what makes sense for you, find teachers who make you feel safe and supported.
Having some of these lifestyle interventions, like whether it's physical activity, for example, allows to have more strings to your bow to meet the client where they're at, if they're more receptive to that.
This is where mental health professionals are kind of uniquely positioned, I think, to encourage people to make lifestyle change, right? Because behavior change science, so much of it, overlaps with things that we're already trained to do, like psychotherapies, like cognitive behavioral therapy, motivational interviewing.
Before we dive into today's episode of the Mental Wellbeing College, an important disclaimer. We do dive into the weeds of mental health, which means that at times we discuss sensitive topics like suicide, self-harm, and substance abuse. If hearing such discussion does bring up distress for you, please do seek the psychological and professional treatment that you need. The content covered in this episode is not intended as a substitute for professional mental health treatment.
Hello everyone, and welcome back to the show. Today we are joined by Dr. Vanika Chawla to discuss all things lifestyle psychiatry and yoga in mental health. Vanika is a clinical assistant professor in psychiatry and behavioral sciences at Stanford University and co-leads the Stanford Lifestyle Psychiatry Clinic. Vanika completed her psychiatry residency at the University of Toronto and a fellowship in student mental health at Stanford University. She's also a practising psychiatrist and a yoga teacher. And in today's episode, we discuss the pillars of lifestyle psychiatry, the evidence base supporting yoga in mental health, the hypothesized mechanisms as to why yoga improves mental health outcomes, the challenges in adopting and maintaining lifestyle behaviors, and much, much more. Today's conversation is kind of split into two parts. We first dive into the lifestyle psychiatry. We then go deep into the evidence behind yoga. And at the end, we kind of amalgamate the two in terms of implementing yoga and lifestyle psychiatry in practice. So if you're here more for the yoga side of things, check out the chapters in the show notes and you can skip ahead. Otherwise, sit back, relax, and enjoy this conversation with Vanika. And if today's episode or any of the other episodes of the show have brought value to your life, we would be so grateful if you were to hit subscribe or follow, or to share this podcast with someone you love. Our mission here is to provide a free, accessible resource on evidence-based strategies that people can take to improve their own mental well-being. And we really focus on lifestyle behavior interventions. So you'll notice a lot of discussions in previous episodes and indeed subsequent episodes focusing on things like exercise and nutrition and sleep, i.e. lifestyle behaviors. And this episode and discussion with Vanika really hits that mark, as well as obviously we focus on lifestyle psychiatry and yoga. So you subscribing, sharing, and not following certainly helps us to spread the word and help improve people's mental well-being the world over. Thanks so much for tuning in. It really does mean a lot that you view and listen to these discussions, and we hope that you enjoy today's discussion on lifestyle psychiatry and yoga with Dr. Vanika Chawla. All right, Dr. Vanika Chawla, welcome to the Mental Wellbeing College.
Awesome. Thanks so much for having me. Excited to be here.
It's fantastic to have you on all the way from Canada. Going to be talking all things yoga and lifestyle psychiatry today. And I'm really keen to get your take on the evidence base for yoga, given your practice and teaching in that space over at Stanford. But before we do, we're going to be covering kind of the nuts and bolts of lifestyle psychiatry, of which yoga is situated as one of the interventions from a physical activity or from a mind-body intervention perspective. So for those who haven't heard of lifestyle psychiatry, can you take us through a little bit about what that term means?
Yeah, so lifestyle psychiatry is a term that was coined by Dr. Douglas Nordsey, who is a psychiatrist at Stanford. And it's inspired by lifestyle medicine, which is a bit more of a broader, well-known entity that's been established before lifestyle psychiatry. And so lifestyle psychiatry looks at how different lifestyle behaviors impact both the prevention and prevalence, as well as kind of management of symptoms of different psychiatric disorders, as well as also looking at how lifestyle interventions can cultivate well-being, improve quality of life, and optimize brain health. And there are many different pillars or interventions that make up the field of lifestyle psychiatry, but that's kind of the general overview.
Yeah, okay. And you bring up pillars there, Vanika. So can you run us through what some of those pillars are? Because I have seen different conceptualizations of the pillars of lifestyle psychiatry, some including things like social connection, others not including that. There are staples that seem to be exercise or physical activity and diet, but some of the others seem to be a bit more inconsistent depending on who you ask. So what are the pillars of lifestyle psychiatry?
Yeah, and I think there can definitely be variability depending on, the provider or the group, and also, based on what patients are needing and what's helpful to them. And definitely lifestyle medicine, for example, has 6 very specific established pillars, but definitely within lifestyle psychiatry, there is variability. But the pillars that I tend to work with are nutrition and diet, physical activity, exercise, mind-body practices like yoga, meditation, and mindfulness, social connections, as well as the reduction of risky substances, and sleep, optimizing sleep. But definitely there are certain folks that will also incorporate things like work and vocation or time in nature. Those can also be different kind of aspects or tenets of lifestyle psychiatry.
We've established what some of those kind of interventions are from a pillar perspective of lifestyle psychiatry. What are some of the benefits of these particular lifestyle interventions that form lifestyle psychiatry, particularly in comparison to more of the traditional treatments, if you like, at least from like a Western point of view? For example, my training as a psychologist was more in therapy as a tool to help mental health, and then a little bit on pharmacotherapy as well. So if we kind of compare lifestyle interventions to those two buckets, if you like, what are some of the benefits?
I might preface that by saying it definitely doesn't have to be an either or thing, right? So Dr. Doug Nordsey characterizes kind of how lifestyle interventions can fit in a helpful way. So he kind of characterizes it as lifestyle interventions can be used for primary prevention, as a first-line therapy, for multimodal therapy, so as part of kind of a system of therapies, for augmentation, or precision therapy for specific symptoms, or relapse prevention, right? So I think it's helpful to think of all of these tools as a system, and then thinking of interventions like lifestyle psychiatry is something that actually expands our toolbox. So these lifestyle interventions can definitely be complementary to medicine therapy. And sometimes it really depends on patient preference, right? Some folks will say, I only want to focus on lifestyle, where for some folks, it might actually be a stage thing. They start with meds and therapy, and then a lifestyle is added for, say, addressing cognition, which wasn't helped with medication, or for relapse prevention, right? So we can really kind of think of this in kind of a broad, systematic and complementary way, if that makes sense. So I find it helpful to frame lifestyle interventions in that way. In terms of the research, definitely certain buckets or certain pillars or interventions have been more researched than others. I would say a lot of the research has been done in exercise and physical activity. And there's a variety in the literature that's out there, including the types of exercise, right? Like aerobic versus strength training, etc. Addressing now your question around how that compares to other kind of evidence-based treatment. So there was a recent systematic review and meta-analyses that looked at exercise versus antidepressants versus combination treatments, and they found that they were actually all similar. I would say the effect size of exercise interventions, and obviously it varies depending on the study, but it tends to be close to what we see with medications, and that network meta-analysis kind of solidifies that, at least for depression.
Yeah, okay. Lots to unpack there, and I like the term you mentioned there, precision psychiatry, or kind of precise tools for the right person, depending on where they're at. And it seems like having these lifestyle interventions certainly allows a practitioner to have more of a shared decision-making approach, to be collaborative with the patient. Particularly, like, I get individuals in therapy coming and saying that they have almost like a philosophical abstinence or philosophical stand against medication, for example, and not trying to downplay the effects of that, but just some people do have that particular standpoint. And having some of these lifestyle interventions, like whether it's physical activity, for example, allows to have more strings to your bow to meet the client where they're at, if they're more receptive to that as a treatment.
Exactly. No, you nailed it. And I think also lifestyle interventions may also be helpful for folks who really want to feel like they, have agency and control over their treatment and can implement behaviors that maybe don't involve reliance on a medication or seeing a therapist. Not that there's anything wrong with those treatments, right? Those are excellent, wonderful treatments. But exactly as you said, it allows us to really expand our toolbox and meet patients where they're at and align our treatments with patients' values, right? Depending on what those values are.
Yeah, exactly. And I think one of the real benefits as well of these lifestyle interventions is kind of the risk benefit ratio, or the side effect profile of, let's just say,
Mm-hmm.
physical activity is quite
Yeah.
low, and if anything is quite positive. If you're doing, aerobic training for depressive symptoms, or one of the positive side effects, if you like, is improved, cardiorespiratory health, for example. Whereas, again, not to downplay the role of medication, but side effects can often include, hindrance of cardiorespiratory health, or more central abdominal obesity, whereas you're getting the opposite of that with things like exercise.
That's a really good point, right? The side effect profile of these interventions can be different than certain medications. And in that study, actually, when they did compare the exercise, antidepressant, and combination treatment, the exercise group did have fewer side effects, right? So kind of, or fewer adverse effects in general, alluding to your point. But also, we can also think of lifestyle interventions in a different way, right? If someone is taking a medication that's really important for them to take, but they are, say, having certain side effects like weight related changes or, cognitive changes, then exercise might actually be something that addresses those adverse effects, right? So that they can continue on a medication that might be helpful and also address some of the adverse side effects they might be having. So really, there's a lot of different ways that lifestyle psychiatry can be helpful for folks.
Yeah, and it's really good to see, to your point as well, about the combination of things like exercise and medication. I don't know what it's like in the States, but here in Australia, a lot of the national guidelines now are recommending the use of exercise as treatment in conjunction with antidepressants, for example, for the use of uh, treatment of major depressive disorder. And this is like, the Royal Australian College of General Practitioners and Psychiatrists, so the large national bodies. So there certainly seems to be more recognition of the use of these lifestyle treatments as an adjunct. What's it like in the States, though? Is it getting leeway and traction?
Yeah, that's a good question. There's certain guidelines, like you mentioned, in Australia
Mm,
and the UK and in Canada, where
yeah.
we're seeing more of these interventions come up. And in the States too, I think, generally reception to these sorts of interventions is increasing, research is increasing, focus is increasing. But yeah, I think there's still also room to go to really advance research, to advance kind of clinical integration and education and so forth. So definitely, I think these types of interventions are getting more attention and reception, and I think there's room to keep going.
Yeah. So on that point then, Vanika, about room to keep going. As I understand it, lifestyle psychiatry is quite a new-ish and an emerging field, despite the fact that dietary interventions for health, at least, and exercise for mental health has been talked about in circles for a long time. But at least the Western, if you like, evidence base is only starting to really get the ball rolling in the last 20 to 30 years, or 40 to 50 if you're looking at exercise, for example. Why do you think it's only kind of catching up now compared to, say, the evidence for something like therapy or medication?
I think that's a great question. I can ponder some potential reasons. Yeah. I don't know if I have the exact answer, but I think one is that, is it that our lifestyle has significantly changed so much, especially in recent decades, with technology, with ultra processed foods, with, sedentary desk jobs, like that now we have no choice but to kind of focus on these things, right? And pay attention to them, because things have really, our lifestyles have changed and kind of now warrant further attention around kind of how that impacts not only our physical health, but our mental health as well. I think definitely there's been a lack of, a formal entity or term for some of these interventions that perhaps providers were already, incorporating. For example, sleep, we know that that's part of diagnostic criteria, as well as, interventions like CBTI, those have been around, but as part of, a formal entity like lifestyle psychiatry hasn't really been there, right? So some of these interventions I think people have been really doing, but maybe not under that umbrella term or in such a formalized way. And, there's benefit to having something be formalized and named in terms of research and funding and clinical and educational efforts. So I think that's perhaps been one barrier. So yeah, those are, I think, maybe two reasons that I can think of in terms of why now, right?
Yeah, because you're situated at the Stanford Lifestyle Psychiatry Clinic. So how long has that been around for, and what's the reception like there in terms of lifestyle psychiatry as an intervention modality?
Yeah, Dr. Doug Nordze, he's the founder of the clinic, and it's now run by Doug Nordze and Helen Wilson, the psychologist. And it's been in the works and around for a few years, but formally, I guess, really has taken off in the last year or so. So pretty new, but the reception has been, really positive, and the department's been really supportive. And so it's great to see. And there's been a lot of interest from residents and trainees as well. And so, yeah.
Yeah, nice. Okay. Yeah. I'm interested to get your thoughts as well on what it's like teaching that to the next generation of clinicians. But let's hold off on that, because I want to dive into some of the evidence on yoga as well, which I know is a real big part of your practice and teaching. So let me preface this by saying I've never done a yoga session in my life. It's something that I've heard a lot about the benefits of just anecdotally from clients, from friends and family. It's something I've put on the calendar as, I should do that, but for whatever reason, just, never done it. But talk to us a little bit about more formally the evidence for yoga. Is there any evidence for yoga, Vanika?
Yeah. Again, interest in yoga-based research has really kind of grown, especially in the last decade or two. Yoga is a practice that has been around for ages. It's, an ancient practice, but in terms of therapeutic applications, that's only something that's, recently garnered interest. And, I would say in the last decade or two, as I said, research has really skyrocketed. There are definitely challenges currently with the yoga research landscape, but definitely, some really positive studies as well. So with respect to depression, yoga is actually recommended in Canadian depression treatment guidelines as a second line adjunctive treatment. And then there have been several systematic reviews and meta-analyses done. One recent one, which was done in 2021, showed that yoga was helpful, had moderate reductions in depressive symptoms across a variety of psychiatric conditions. So schizophrenia, bipolar, anxiety, major depression. And this review actually showed that it was dose dependent. So the more, the better. There have been studies looking at, for example, people with treatment-resistant depression who are already on antidepressants and yoga as an add-on. And they showed that the yoga group, showed greater improvements in depressive symptoms compared to the control group. There was a study recently done that compared yoga to cognitive behavioral therapy to a stress education group for folks with generalized anxiety disorder, and showed that yoga was helpful for anxiety symptoms, more helpful than stress education, but not quite as helpful as CBT, which is the gold standard. So this was a really nice study because it kind of, to your earlier question, kind of compared yoga to treatments that already exist, and also, included participants with a kind of a diagnosed mental health condition like generalized anxiety disorder. But there's been studies on yoga for schizophrenia, PTSD, ADHD in children, adolescents, at schools. It's really kind of for stress reduction. So a lot of literature out there. Though I would say there are, sometimes challenges with the quality of the study. Not all, there's a lack of kind of robust randomized trials and so forth, but definitely there is lots out there.
Yeah. As I understand, in the last decade or so, there have been some, randomized control trials showing its efficacy, and like you said, the systematic reviews and meta-analyses showing a range of mental health challenges and mental illnesses. So certainly, my take on it is that the evidence is there, but there's a long way to go in terms of, like you said, robustness, but also like the heterogeneity between different yoga practices, right? Because as I understand it, there are dozens, if not scores, of different practices.
Yeah, that's an excellent point. I would say that is one of the biggest challenges of the current kind of research landscape. So yoga, when a lot of people, when they think of yoga, they think of postures, but that is actually just one, part of the greater practice, which can include things like breath work, meditation, lifestyle, ethics, values. There are so many different lineages and traditions and adaptations. And even when you look at the literature, some interventions are posture only, some are just meditation and breath work, some are more integrative and holistic. So there's so much heterogeneity, and there's no widespread kind of standardized protocol. So it's really hard to study because we're studying different things, right? Which definitely makes the research challenging. So yeah, that's a really good point around the heterogeneity.
Yeah, okay. Can you, again, recognizing that there is heterogeneity or variance between the studies and the interventions, can you give us an insight as to what a yoga intervention for mental health might look like, either one that you've seen in one of these RCTs, randomized control trials, or one that you've delivered yourself? Just give us an insight into kind of the nuts and bolts of it.
So it can vary. Maybe I'll preface by saying there's yoga classes, and I credit this distinction to Chris Brems, who's the director of, so Stanford actually has its own yoga teacher training program that's focused on bringing yoga into healthcare called Yoga X. And so that's run by Chris Brems, who's a wonderful psychologist and a yoga teacher. She kind of divides these interventions into three. So there's yoga classes that you would, find in your community at the local gym. And then there's therapeutic yoga. So that's yoga with therapeutic intention for a certain kind of physical or mental challenge, often done in groups. And then there's yoga therapy, which requires additional training beyond the standard yoga teacher training. And it's typically one-on-one. And it's utilizing yoga kind of in therapeutic ways for a specific condition. The interventions really vary. For example, a yoga for stress reduction group. And so that involves, stress education, and then practices like postures, breath work, meditation, value clarification, community contribution, kind of pulling in some of the other kind of limbs of yoga. So, that's kind of one example of what kind of an integrative, holistic kind of therapeutic yoga intervention might look like.
Yeah, okay, so that's really interesting. The yoga for stress reduction intervention that you're running. So, are the different components that you're running in that intervention, are they all yoga centric, or are you pulling in, so values clarification sounds like something I've seen in acceptance and commitment therapy, for example? Are you pulling in different parts from different therapy modalities, or is it all, under the umbrella of yoga, if you like?
One particular yoga theory is the 8 limbs of yoga. So that involves what we call yamas and niyamas, which are the ethical, value, lifestyle limbs, and then postures, breath work, and then different limbs of inner practices, including sensory practices, meditation practices. I'm personally pulling in kind of some modern psychology stuff too, but the values stuff also does overlap with some of the ethical, lifestyle, and value limbs of yoga. So I kind of all back to your point, right? Yoga is such a broad, diverse practice. It really was intended to be a lifestyle. And so different practitioners will focus on different things based on their experience. And then obviously as a psychiatrist, I'm going to be tempted to pull in some modern psychology and all of that as well. And so, yeah.
Okay, yeah, I know. I'm very curious. Just starting my own PhD, and part of one of the trials I'll be running is an exercise plus psychological skills training. So this is
cool.
teaching people teaching people cognitive restructuring, cognitive diffusion, just a bunch of different skills plus exercise versus just the skills itself. So I'm interested to hear about how you're running your trial. What are the kind of outcomes that you're looking at? Is it all mental health outcomes, or are you kind of looking at more academic outcomes if it's in students as well? Or?
Yeah. So I must say, the group is starting in 2 weeks, and the first trial is just going to be a pilot. So no data collection, but I'm planning on, since it's yoga for stress reduction, just looking at the perceived stress-related subjective measures. Ideally, it'd be great to have, stress-related biomarkers as well. But that's kind of where I'm starting, since it's a trans-diagnostic group. And so, yeah.
Nice. Okay, cool. Yeah, I'll be interested to see the results of that one. Yeah, so very interesting. So we have alluded a couple of times, Vanika, to the heterogeneity or the variance between different yoga practices. And this seems to be underpinning one of the limitations of the current yoga evidence base, which is, what are the mechanisms? Okay, it works, like you pointed out. There are all these RCTs, meta-analyses showing reductions in depressive symptoms, anxiety symptoms, but why? Why does it work? So can you speak to some of the hypothesized mechanisms as to why yoga might work?
Yeah, so there are a few kind of hypothesized mechanism. One kind of well-accepted mechanism for yoga and mind-body practices in general is, top-down, bottom-up mechanism. So that's kind of the bidirectional pathways between brain and body to brain. So top-down processes are things like regulating our attention, awareness, intention setting, and this can then have downstream effects on the autonomic nervous system, hypothalamic pituitary axis, which then, can impact things like immune function, inflammation, heart rate variability, and so forth. And then bottom-up practices are practices like breath work and movement, often largely mediated by the vagus nerve that influence central processing through ascending pathways, right, from body to brain, and then also can impact autonomic nervous system function, hypothalamic pituitary axis function, and then again downstream effects on similar aspects like inflammation, immune function, etc. So that has been one postulated mechanism, and our understanding of the pathophysiology of psychiatric disorders is still evolving, right? For depression, for example, neurotransmitters like serotonin were thought to be central, and now it's kind of expanding to include things like inflammatory markers, right? And dysfunction in the autonomic nervous system or hypothalamic pituitary axis. So that's one mechanism. Other mechanisms, studies have shown that yoga can change, neurotransmitters like GABA and oxytocin through the practice. And then some neuroimaging studies have shown a lot of impressive brain changes as well. like changes in the default mode network, which is involved in self-referential processing, changes in the prefrontal cortex, changes in the limbic system involved in emotion regulation. Another pathway is through like sensory processing, through actually what we call like interoception, having a better sense of our sensations, which can help with emotion regulation, self-awareness, self-regulation. And I'm obviously oversimplifying it a little bit, but yeah, that's kind of the broad overview of some of the mechanisms.
Hello everyone, a quick break from today's episode. At the Mental Wellbeing College, we are committed to the goal of communicating evidence-based wellbeing strategies out to the broader community. The goal of this podcast is to bridge a gap between self-help material and peer-reviewed research by providing evidence-based discussion that respects the nuances of psychology but is digestible for all audiences. Ultimately, I hope that you as a listener feel empowered after each episode so that you can take away and implement strategies to improve your own mental well-being. If you have gained value from this episode of the Mental Wellbeing College, I would be so grateful if you were to hit subscribe or follow, or to share this episode with someone that you love. This is how we continue to grow the show, get the message out, and to impact people in need by providing such information and strategies. Thanks so much for tuning in. It means a lot to us here at the Mental Wellbeing College. And now back to today's episode.
No, there's a lot there in terms of potentially why it might work. So I appreciate you running us through that. And it seems like as well, potentially cognitive functions as well, because there's a lot of the yoga practices, as I understand it, there is a meditative kind of component to it. So things like attention, inhibitory control may possibly play a role as well, which I think is important, right? Because you alluded to this earlier, but sometimes more traditional treatments struggle to target the cognitive symptoms that go along with things like schizophrenia or depression. So having these treatments which can address more of the depressive symptoms, but also the cognitive functions is important. And I'm referencing a Singh 2023 systematic review on the cognitive improvements of yoga, and I'll put that in the show notes for people. But it seems like there's a lot of different mechanisms there.
Yeah, for sure. Yeah.
And one of the reasons I assume it's difficult to pinpoint which one of those mechanisms that you ran us through is responsible for which practices, it's hard to run dismantling studies or component analyses where you take out different parts and narrow in on what the function is.
Yeah, for sure, right? Especially when it's an integrative practice, it can be hard to figure out how the breath work is different from the meditation, is different from the postures. And also sometimes these things are synergistic and complementary. So yeah, it can be hard, and there's not that much literature on dismantling these different pieces, right? And also on like what dose, what frequency, like how much breath work do we need to do, how much meditation, or how often, right? So there's so much that's still unknown.
Yeah. Well, on that point then, so are there better forms of yoga? As someone who's researched in this space, is a yoga teacher or practitioner? What's the technical term? Is it a teacher or a practitioner, or?
But both is fine, yeah.
Oh, okay. Yeah. We'll go with teacher. That's a bit easier for me. So, yeah, what are the better forms? What is your advice in terms of that? Which is a better yoga for mental health specifically?
Personally, I think, for example, Stanford's Yoga X program, they teach, yoga in an integrative and holistic manner. That is my preference. Provide a practice that's holistic, that's integrative, that has different components, because I think it gives people different access points and different kind of modes of benefit. For folks with specific mental health challenges, it's important to note that, sometimes community or gym yoga classes may have limitations, right? They're not always. Sometimes they're really just focused on physical fitness and not so much the psychological aspects of the practice. And so folks who are interested in utilizing yoga in more of a therapeutic manner might specifically look for classes that allude to therapeutic benefit, right? So yoga for stress reduction, or yoga for anxiety, or maybe yoga practices or groups that are offered in clinical or therapeutic settings may be able to provide more of a integrative, holistic, and patient-centered practice. But in terms of the types of yoga, there are hundreds of different types, like hatha, vinyasa, yin, and so for folks who are just exploring kind of community classes, I would say, try different classes, see what makes sense for you, find teachers who make you feel safe and supported. And know that if you try a yoga class and you hate it, still don't give up on yoga, because it might not have been the right fit for you or the right class for you, and that there are so many different, types and styles out there.
Yeah, that's such an important point, right, about fit, because there are, many different ways to skin a cat. And if we look at, I'm talking more now general physical activity literature for mental health, which is a space I'm a bit more familiar with compared to at least the yoga evidence base. But there are so many different ways, whether it's aerobic exercise, cycling, walking, resistance training. There is good RCT, if not meta-analytic evidence, for all of those different types of exercise in reduction in depressive and anxiety symptoms, such that choosing what you are going to be able to stick to more in the long term is really the key. Or what can you adhere to, rather than trying to find the magic pill that might work, has the largest effect size, but if you can't stick to it, you're not going to get that benefit anyway. And I'm assuming some of that probably applies to yoga as well.
Totally, right? We have like what's in the research or textbook, and then we have like the real person in front of us, right? And I totally agree, and that's how I approach it too, in terms of, finding what you like, what makes sense for you, what fits for you, what you can stick to, because you're more likely to stick to something that feels meaningful, is aligned with your values, that feels beneficial, right? And that you can get benefit from a variety of different practices if it's aligned with your values, and if it's something that you feel motivated to do, then definitely it's going to have more longevity and benefit through that.
So you alluded to something like yoga therapy earlier, not something a term I've come across at all before. So I'm just thinking, for someone listening, say with mental health challenges or a mental illness, if you like, if they're wanting to seek this out, are there ways of knowing what is yoga therapy versus a more generic yoga class? And I think this is an important question, because a lot of the evidence, say for physical activity in general, again, for those with mental illnesses like depression, one of the key moderators is doing it supervised by a trained professional, seems to have larger effect sizes. So how can someone kind of sift through what is yoga therapy? Who are the trained yoga therapists? Are there ways of going about that?
Yeah, so you have your community classes where ideally teachers should have a minimum of 200-hour training registered with the Yoga Alliance. If you're working in a healthcare setting, then someone may still integrate yoga and their, healthcare expertise and integrate that. So obviously seeing someone who also has healthcare expertise. And there are new kind of what we call therapeutic yoga programs starting that allow healthcare practitioners to kind of integrate yoga. And then there's yoga therapy. So there's the International Association of Yoga Therapists. And this is an 800-hour approximate training, right? So it's different than the 200-hour training kind of minimal. Yoga therapists are registered with this association and governed by this association. So that would be something to look for, right? The credentials of who you're seeing, both their yoga credentials, and then if they have any other additional kind of healthcare professional credentials as well, that can probably kind of help guide and give a sense of what type of intervention you might be receiving.
Yeah. Okay. So there's like an international body. What did you call it? Sorry, the Alliance for
the International Association of Yoga Therapists.
Okay. Right. Okay. Cool. So that's a good way then, perhaps, for people to know, who is accredited and who has a bit more specialized training.
Yeah.
Okay.
And then Yoga X, the Stanford Yoga X group, is actually starting this pilot therapeutic yoga program. So that's kind of, I would say, not as much training as the yoga therapy, but kind of this a 300-hour additional training for people who are healthcare providers and want to integrate yoga. So, that's something that just to put on your radar as well, something new that's starting up. So
if someone's wanting to get started today in yoga, let's say, particularly again from a mental health side of things, they're wanting to engage in some therapeutic yoga or yoga therapy. Do you have any tips to help overcome barriers or just tips to get started in such a practice?
So a challenge of yoga is that it's such a heterogeneous practice. Of course, that's a challenge in research settings. But in real life, I think it actually makes for a really beautiful practice because there's so many different ways to get involved with yoga, right? There's no one size fits all, which is beautiful because it can be really person-centered. So I think yoga can look like a lot of different things for folks. It can be 5 minutes of breath work, some diaphragmatic breathing, right? Doing a meditation on an app, going to a class and trying the different postures. And there's a different variety of classes, right? Looking at the ethics and lifestyle limbs of yoga and practicing, learning about some of the yoga philosophy. Of course, if you're using it for therapeutic medical purposes, then you should, talk to your provider. You should make sure you're getting supports from people who are well trained and be thoughtful in that regard. But just for general well-being and mental health, I think there's so many different ways to, connect with the practice of yoga. And it doesn't have to be, something that you do for hours, multiple times a week. You can start with a few minutes and see what types of practices are helpful to you and kind of grow from there based on what makes sense.
Yeah, nice. Okay. Just thinking out loud as well in terms of barriers, I think for myself, to be honest, there's probably an element of self-consciousness. I don't even know if you have to be flexible, but like I can barely touch my knees, let alone my toes. So I have this image of being in a yoga class and snapping my hamstring or not being able to do anything. So are there like apps or something that people could try as like a step at home in a more safe environment before jumping into something a bit more intense?
Yeah, well, you bring up a really good point. I think there's a lot of stereotypes around yoga, right? That it's for people who are, often we think of someone who's thin, flexible, white, wearing fancy yoga clothes on the cover of, a magazine. Yoga as a practice in turn has become very westernized and commercialized. And so these are real barriers, like you said, right? And so sometimes, not all classes are inclusive or person-centered, and maybe you do kind of perpetuate some of these stereotypes. So I do want to acknowledge that, right? And I think cost is also another barrier, time, and yeah, these kind of myths which are sometimes not myths about what yoga is, right? Because of experiences that people really do have in certain yoga classes. So yes, that's definitely a real thing that I want to acknowledge. So YogaX, they have online videos, which could be helpful. And you can, do them online. They are longer, but they kind of do, take that integrated, holistic kind of approach. Definitely there's a lot of great meditation apps out there. Like Headspace, Calm, those are great. For breath work, you could, just diaphragmatic breathing is a great way to start, and you can, you find YouTube videos to access that. So I think those would be some good starting points. And then, yeah, just getting a sense of what's in the community and seeing what types of teachers are out there, and if there are teachers who, have created more inclusive kind of spaces for folks, would be another place to kind of start.
Yeah. Do you get much of these barriers from particularly like male participants?
Yeah, I think a lot of if you look at a lot of the yoga literature, I think a lot of the participants are female. And yeah, when you go to classes, anecdotally, people are mostly female too. And I would say recruiting for my group, there are some males, but yeah, generally more females. And so, yeah, I think that is just exactly what you said. When you think of yoga, you have a particular image of what that practice entails, right? And what the class is going to be like. So definitely, I think, yeah, there are some gender, challenges and biases for sure.
Yeah. Like I said, the image that I have is 20 fit, mostly, not even fit, just really flexible women, and then there's me in the back just struggling and groaning and trying not to, tear my hamstring in half as I touch my toes.
Yeah, I've tried to drag my husband to many yoga classes, and he does not have a good time. But we've been doing some, individual work at home, and like in more of a kind of accessible way. And he really loves that, right? So I'm hopeful that, as yoga becomes more integrated into therapeutic spaces, that we do start to make it more accessible and person-centered and holistic, and start to address, some of these myths. And yeah.
I'm really appreciative of those tips, particularly from drawing upon your experience as a yoga teacher, and I think certainly those videos I think are a good space for myself to start, and hopefully there are really accessible ways for other listeners to start based on what you've said, Vanika, as well. But I'm also really curious to get your take as a teacher of lifestyle psychiatry as a clinical assistant professor at the Stanford Lifestyle Psychiatry Clinic. Now, I want to preface this by saying that one of the reasons I'm really fascinated in the teaching of lifestyle behaviors is in my psychology sequence. So here in Australia, it's a 5 to 6 year sequence. Sequence being studies formally at university that you have to go through, plus some extra training to become a psychologist. It was really not taught at all, it being lifestyle behaviors. So sleep, physical activity or exercise, diet were barely mentioned in that whole 5 to 6 year sequence that I did. And I thought, to be honest, it's a real blight upon the system that this isn't talked about, particularly when we reference some of the benefits, as we said earlier, that it has a real unique place as a standalone or adjunct treatment. Again, not to discredit therapy or medication and their places, but when we look at things like the mortality gap, people with severe mental illness live 15 to 20 years less than the general population. A lot of it down to lifestyle behaviors, not exercising, poor diet, poor sleep, etc. So I want to preface that and ask you, what's your experience been like teaching these lifestyle behaviors and lifestyle psychiatry at Stanford?
So, I am a relatively new staff, just recently kind of graduated from fellowship about a year and a half ago. I think there is been a lot of, even just in my short time here at Stanford, there's been a lot of interest and reception in lifestyle psychiatry, and a lot of trainees who kind of want to get involved. And kind of exactly as you alluded to, these interventions are often missing from our educational curriculum in a kind of formalized way. And I think we're seeing that there's a real kind of interest and desire to learn about these practices, and also learn about how we then integrate them clinically, because we're not always trained to kind of to do these things, right? And so and even as a staff, I'm still learning what the best way is to kind of integrate these things, because it's not something that's been formally taught, definitely not in my residency as well. So yeah, I think people are overall pretty receptive to it, and eager to learn, and it's great to see.
Yeah, nice. Okay, so from a student and trainee perspective, you've seen the uptake is pretty good, and reception is pretty positive.
Yeah, for sure. There's definitely been students interested. Yeah.
What about from like an administration or university point of view? Because this might be the real skeptic in me coming out, but these can, I think, from the role of big pharma, can, if I was, I don't know, an executive in big pharma, this could be potentially, counterproductive to my own vested financial interests, right? So to if you have people engaging in these lifestyle behaviors to the point where they don't need medication, this could be counterproductive from their points of view. Again, recognizing that this isn't a replacement for antidepressants or therapy. Everything has its place, and referencing things like the stepped care model. But just talking about the inner cynic in me. So what is it like from an administration, from a university, from a college point of view, both at Stanford and if you can if you have experience seeing at other colleges as well, is there much uptake in the States at all about lifestyle psychiatry?
So I think definitely different centers are, focusing more on lifestyle psychiatry. Our department has been really receptive and encouraging of this initiative. In the UK and in Australia, there are groups also, really focusing on lifestyle and psychiatry. And so definitely it's not something that you would see at every academic center or every hospital. This is relatively new. People don't know what the term means. It's still kind of in early kind of pioneer stages. But I think there are some centers where there is support for this, but you're right. There are challenges, other challenges include reimbursement and insurance, right? And time and incorporating the right allied health team members. So there's a lot of work that still needs to be done to move this field forward, like specifically at, our clinic, we've had some of these challenges. So, I would say definitely we're in early stages, but I also think, people, perceptions are changing and folks are interested and curious and receptive, but I'm also not an administrative lead, so I can't speak to the nitty-gritty details, but
Yeah. Well, you referenced something important there as well about like this multidisciplinary team and having, other allied health practitioners on board. And, at the couple of psych clinics that I've worked at recently, I think that's one of the hesitations from psychologists at least is, knowing that, okay, we have this evidence base for exercise, but I'm not an expert in exercise. Again, alluding to the fact that they haven't been taught this formally, or nutrition and diet, a bit more of a earlier emerging kind of field compared to the exercise side of things or mental health. But okay, great, we have some correlational observational evidence for some particular diets, like the Mediterranean diet with depressive symptoms, but when do I refer out to a nutritionist or a dietitian? So is that a challenge you're seeing as well, about practitioners being unsure and doubtful about prescribing and versus referring out?
for sure, those are all really good points. And I think there's kind of different facets to what you just brought up, right? One challenge is probably just challenges with knowledge base, right? If these aren't things that we're learning about, like what is even the right nutritional recommendations to make with someone with certain mental health challenges, right? And what are the right exercise interventions? So yes, definitely there are challenges with providers probably knowing what the right information is. And then the second part then is the execution, right? Like one piece of that is sometimes you don't have enough time in a visit to do the meds, do the therapy, and also, focus on some of these things. And so that's one piece of it. And then referring out, most mental health clinic teams don't have a nutritionist or an exercise specialist or, these professionals. We're lucky. We, are piloting a health and wellness coaching program. So we have someone who's trained as a health and wellness coach and an expert nutritionist. So, but we, had challenges with reimbursement and getting that started. But definitely, I think that is where hopefully the field will go, is that we build multidisciplinary skilled allied health teams that can offer these interventions that we might not be trained in or might not have the time to do or the expertise to integrate. So yeah, that would be the ideal. I think that, you have a team with people who have expertise in all of these different things and can actually offer it in the clinic, right? To reduce time and cost barriers, and kind of people can work together to really support patients.
Yeah, that's so true. And especially here in Australia in private practice, things are often done in silos where the psychologists work together, the nutritionists work together, the exercise physiologists work together, but separately from each other. And that makes difficult when you're not talking to each other. So one really important area of lifestyle psychiatry, at least in my opinion, is the art of coaching, the art of prescription, right? So again, if we kind of reference the physical activity evidence base as an example, there's clear evidence for the use of exercise in the reduction of depression and anxiety symptoms, right? The evidence base is there, but despite that people have challenges adopting exercise as a practice and then maintaining that, sustaining that as a lifestyle choice. So I'm very interested to know, and your program that you teach at Stanford, do you guys teach clinicians the art form of coaching, if you like, of actually getting your residents, your trainees to actually coach patients to be able to sustain and maintain these behaviors as part of their lifestyle?
Yeah, no, that's a really excellent question, an excellent point. And I think this is where mental health professionals are kind of uniquely positioned, I think, to encourage people to make lifestyle change, right? Because behavior change science, so much of it, overlaps with things that we're already trained to do, like psychotherapies, like cognitive behavioral therapy, motivational interviewing. And so, yes, there are many different theories of behavior change science and different kind of, philosophies. But yes, that's a really important part of getting people to change, right? And I think for me personally, it depends on the patient in terms of what strategies we'll use. Sometimes more MI depending on their, readiness to change. Sometimes we, will use things like SMART goals and behavior tracking and monitoring and check-in. Sometimes, principles of CBT can be helpful, or ACT. So yeah, but definitely the behavior change strategies are crucial to getting people to adopt and maintain, lifestyle strategies. And that is definitely part of this work, is to bring in those behavior change strategies and support our patients to make these positive changes.
Okay, so that is like a big part of the program that you guys teach, is it?
And our work, right? Like you said, it's one thing to, if someone comes to your visit, just telling them about exercise isn't enough, right? We have to support people in making these changes. So yeah, I'll definitely, in our visits, support people with that and check in around that, and provide, therapeutic supports to help people adopt and maintain behavior change. Yeah.
You're right. It is such an important point. And I often wonder what kind of training physicians get, dietitians get, exercise physiologists get, as far as the behavior change principles go, because you're right, like a lot of that overlaps with major, health psychology theories. And I know we get a lot of training on that, which is great. But if patients are going to see their physician, their exercise physiologist, and are just being given, like you said, the recommendation of do X, Y, and Z without the background support of how to make that habitual and part of your lifestyle, then there's a big implementation gap there.
Totally. And that's where, mental health professionals like psychologists and psychiatrists are really important, I think, to this movement, right? Not just lifestyle psychiatry, but lifestyle medicine in general.
Thanks so much for tuning in to today's episode of the Mental Wellbeing College. If you've made it this far, it means you've gleaned a ton of value from today's episode, or you've fallen asleep. I sincerely hope that it's the former, and if it is, I would be so grateful if you were to hit subscribe, follow, or to share this podcast with someone you care about. Our mission here at the Mental Wellbeing College is to provide a free and accessible resource for people to take action and implement to improve their own mental wellbeing. And you subscribing, following, and or sharing helps us to achieve that mission and to impact people in need. Thanks so much for tuning in. It means a lot. We'll see you next week on the Mental Wellbeing College.